We're in lab 18 to 20, the cardiovascular system. In this lab, you're going to learn the heart and the blood vessel. So these are the objectives. You need to be able to identify the different heart parts. I can give you a heart model. Outside, inside, identify the structure, and you need to tell me what's that structure. And also, I'm going to ask you those big blood vessels connect with the heart, and also the blood vessel in the whole body. Okay, so here are the heart structure you need to be able to identify. So I put this picture. The picture comes from your textbook. So that's the heart, the front view. You need to be able to identify those two atrium, these two ventricles, right atrium, left atrium, right ventricle, left ventricle. So common mistake. So I put this here, and sometimes students will tell me that's the left atrium. That's wrong. It's not on your left. You have to take this heart, turn 180 degrees, put into your chest. And if it's on the right, that's on the right. So this is right atrium because this is supposed to be on the right side inside of your body. So this is right ventricle. And you can also see some blood vessel. This is aorta. And this is the pulmonary trunk. So pulmonary trunk can diverge to the left and right pulmonary artery. And this is vena cava, superior vena cava. And that's the posterior view of the heart. So the right atrium, right ventricle, left atrium, left ventricle. And you can also see some blood vessels. So superior vena cava, inferior vena cava. They're going to go to the right atrium. And these two are the pulmonary artery. So they're going to send the blood to the lung. So they're artery, but they're blue because they carry the oxygenated blood. And that's the aorta. And this, the left atrium, connect with 4 pulmonary veins. So they carry oxygenated blood from the lung. Okay, when we cut it open, you can see the inside. And the separation is called the septum. So this is called the interventricular septum. They separate the left and right ventricle. And now let's look at the valves. The valves can separate the right atrium to the ventricle is called the tricuspid valve, also called the right AV valve. And this is called the bicuspid valve, also called the left AV valve. And these valves connect to the papillary muscles through caudate tendons. So these streams are the caudate tendons. Okay, now let's look at the semilunar valve. That's the valve between the ventricle to the big artery. So you have the pulmonary semilunar valve. You have another one right here being blocked. It's called the aortic semilunar valves. So these are the structures inside. And you also need to be able to identify those big arteries in the heart called the coronary artery. So here's the right branch, the left branch. And these branches, when we talk about the heart attack, that's when this branch, those coronary arteries been blocked. And when they've been blocked, the downstream of the heart muscle won't be able to get oxygen, and they start to die. This heart attack. So you may hear some bypass surgery, put a stem inside. They're all dealing with those coronary artery. Now let's look at the blood vessel. Blood vessels have 3 layers. So the outside is called the tunica externa, the middle part called tunica media, and inside called the tunica interna. So there are 3 layers. For the artery and the veins, they both have these 3 layers, but for the artery, they have more muscle layer. And the reason is they're closer to the heart, so they need to take the pressure from the heart. They have more smooth muscle. And the veins, they have less smooth muscle, but they have a bigger inner diameter. Okay, now let's look at those arteries and veins. So you need to be familiar with those blood vessels in the heart, in your whole body, not just in the heart, in the whole body. And we talk about them in the lecture. So I will point at the artery, ask you what's the name of this artery or what's the name of this vein. So these are the picture from your textbook. First, start from the heart. Start from the heart, you have the aorta. And aorta, when you go to the aortic arch, it branches to three branches. First one called the brachiocephalic trunk. The second one called the left common carotid artery. This artery go to your neck. And the third one is left subclavian artery. And the descending aorta will keep going down to your whole thoracic cage, abdominal cavity, and keep going down to your lower body. So when they start to branch out, it's called the common iliac artery. So they start to branch out. So they are ready to go to your two legs. But actually that's still in your abdominal cavity, not reach your leg yet. And when they keep branch out, they keep going down, okay? This iliac artery become the femoral artery. So femoral is a big word to say your thigh, so it become the femoral artery. And the femoral artery will go to your knee. It's called the popliteal artery. And you keep going down to your whole leg. So now let's look at the arm part. We're going to use the next picture to look at this. So these are the artery branches go to your arm. So again, from the aorta. From the aorta, three branches. Brachiocephalic trunk, that's the first one. Left common carotid, second branch. And the third one, left subclavian. So three branches from the aortic arch. And now let's look at the brachiocephalic trunk. That's the first branch from your aorta. The brachiocephalic trunk branch out to the right common carotid and right subclavian artery. So your heart actually a little bit closer to your left side. So they go to, on the right side, they go to the brachiocephalic trunk first, then they diverge to these two, right common carotid, right subclavian. And right subclavian artery will keep going, so become the axillary artery. Axillary artery is in your armpit. And you keep going down to the brachial artery. So the brachial artery, that's the artery you measure the blood pressure. That's the artery you block the flow. And you measure the blood pressure from the brachial artery. And now the artery keep going down and become the radial and ulnar artery. So it support action of your arm. In the vein system, most of them share the same name as the artery. So here are the pictures of the vein. Also the picture from your textbook. And these are the veins in your arm. And let's pick one to talk about, the median cubital. Why I talk about this? Because when you draw blood from your patient, there's the vein you're going to take blood, median cubital. Okay, that's it.